viewers of Amasel TV, greetings once again, and it's another blessed day, another blessed opportunity to share something with you. Okay, so today we are on the program we have entitled The Health First. The Health First has to do with considering our health and knowing some of the things we should do at emergency time. Today we are just treating the condition cardiac arrest. Yes, cardiac arrest. Someone may ask, why are we choosing cardiac arrest? All of a sudden, you just see someone falling on the floor, collapsing. Most of the times with a complaint, my heart. And just after some few seconds, the person pass out, or the person dies. Yes, we just get confused and don't know how to help such a person in such a situation, and we keep on losing our dear brothers and sisters. So today we have taken it upon ourselves to treat that particular emergency case, so that in case we happen to experience one or a person experience something wherever we are, we can be able to save the person. Okay. Let's talk about the introduction. The cardiac arrest simply means heart arrest. In other words, the cessation of the heart function or the stoppage of the heart. The heart might be operating and all of a sudden the heart stops. Yes, immediately the heart stops. A lot of functions of the body also stops. So therefore it causes it to be what we call the cardiac arrest. And mostly it comes with the pain and etc. The pain it comes with and etc. At this point, the person suffering it cannot do anything about it, but rather to just call for help. Causes. What actually causes it? Sometimes respiratory failure can lead to cardiac arrest. Respiratory failure has to do with the respiratory system failing its functions, or the respiratory system failing its ability to operate. Yes, and most of the time this respiratory failure also comes from other respiratory diseases or other traumatic incidents like accidents and etc. that damages our respiratory system and causes the respiratory system to fail its work, or to fail producing its function. Cardiac arrest can also be caused by other disease infections. So you can have conditions like myocardial infarction, which has to do directly with the heart. You can have other infections in the system, many other infections in the system that may lead to cardiac arrest. So as an individual, once a while you check your well-being in a hospital to know which of your organs is having a problem, so that it will be corrected or it will be fixed, or medicines and things will be given so that you don't fall into cardiac arrest. Signs and symptoms. The person who is under the cardiac arrest, initially will start feeling chest pains. You get it? So when the chest pain starts, that's when the person starts to complain. And this is not just a normal chest pain. We sometimes feel some small chest pain. No, this one is a crashing type of chest pain, when the chest feels like it's crashing, or somebody is crashing our chest. Yeah, mostly there's discomfort in spreading our shoulders because of the crashing effect. We find it so difficult, or it's discomforting whenever we are spreading our shoulders, our arms, our neck, our jaws. Yes, this is also a sign of what's cardiac arrest. Then we also have fatigue, which has to do with extreme tiredness. Yes, extreme tiredness. You feel so tired. You feel so tired. So immediately you feel so tired. You are not being able to raise your shoulders or open it up, your neck, your jaw. And you have chest pain. It should give you a sign that you are under a cardiac arrest. And our women mostly experience atypical symptoms. So atypical symptoms have to do with feeling nauseous, the feeling of vomiting, but the vomiting is not coming. That's what we call nauseating. So you feel like there's something on your chest, you want to bring it out, but it's not coming. Yes, we have indigestion, jaw pain, you have problem with your jaw, you have indigestion. If you have eaten something, you feel it in your stomach, it's being indigested, you get it. And you have shortness of breath without chest pain, so you just feel like you are breathing but it's not coming. Yeah, without chest pain. That's what we call the atypical symptoms in most of our women. Yeah, so whenever you see these signs and symptoms, you should know that yes, you are under arrest and it's possibly a cardiac arrest. On our next slide, we have the preventive measures. Now, someone will ask, what are the preventive measures? The cardiac arrest can be prevented. Yes, it can be prevented in several ways. If you are already smoking, the best thing you should do is to quit smoking. If you're already smoking, the best thing you should do is to quit smoking. But then, if you are not smoking, then you keep on and avoid smoking. Yes, you quit smoking or avoid smoking. You also maintain a healthy diet. Yes, a healthy diet. You will take our time to treat a healthy diet in one of these days. What a balanced diet is, what a healthy diet is, and what a diet is. Most of the times we just eat anything because of to please our taste buds and etc. But then, after pleasing our taste buds, are we pleasing the organs in our system? No. So therefore, an individual, we should focus on eating a healthy diet. Yes, regular exercise. Regular exercise. Regular exercise has to do with involving ourselves in normal exercise, taking a walk, massage, arm exercise, extensions, and the rest. Yes, arms and extension and the rest. Then we should maintain a healthy weight. Yes, everybody wants to gain weight, everybody wants to gain weight, but then we should maintain a healthy weight, not oversize or extra. Yes, we should just work on our weight very well. We should also control our blood pressure. Yes, we should control our blood pressure. We should know our numbers. We should know what numbers we have in terms of our blood pressure and etc. We should also manage diabetes, the amount of sugar in our blood. We should manage it. We should limit alcohol or avoid it if possible. Yes, limit alcohol. We should also reduce stress. Try not to stress ourselves. Just keeping our composure, just keeping our peace and etc. Then we should get a quality sleep. A quality sleep. A quality sleep we have here has to do with sleeping within about 7 to 8 hours a night. About 7 to 8 hours a night. Yes, and the more we get a quality sleep, the more we are reducing stress. Now, assuming we are not able to prevent this and it happens to us or one of anybody we know, what should we do if we are at the premises? Management. When someone is under cardiac arrest in an area in which you find yourself, the first thing you should do is to call for help. That is the very best thing you can ever do to save a life. Call for help. Call for an ambulance. Call for a hospital. Just call for help. Cry out for help. Good. After crying out for help, if you are already a health worker who knows first aid in cardiac arrest, or who can handle such situation, the next thing you should do is to check if the environment is secured enough, free enough, protective enough for you to carry out the following steps I'm about to show you. But then, if you are not any of the above and you are just a normal random person, but things you can or have the courage to assist such a person, you first of all have to make sure the environment is safe and sound. Safe and sound has to do with people not obstructing what you're about to do, people not overcrowding at your place. You should be able to control the crowd before you take on this particular exercise. First of all, what we see people do is they start to pour water on the person. They start to pour water, shake the person, and etc., which is not the right way. I didn't say a common thing or the person is hungry, so at that moment they try to feed the person ice kinky, whatever. No way. That is actually not right to do. The first thing is place the person on the ground or on a flat, hard surface. It shouldn't be soft. It should be a hard surface with the face facing up. With the face facing up. Okay. Kneel by one side of the patient's chest, so the chest region. Yeah, the chest region. You kneel by one side of it. Then you place the heel of your left hand over the lower half of the sternum. So the heel, the heel of the right hand over the lower half of the sternum, and place the left hand on top of the right hand. Now keep your shoulders extended and push vertically downwards for about 4 centimeters in an adult and 2 centimeters in children. Yes, in an adult, you push, you make sure the chest is decompressed into about 4 centimeters inwards of the chest. Yes, then from there, the next thing you do is to release the pressure. So you push and you release, you push and you release. You repeat this cycle for about 60 to 7 times in a minute. You should make sure you go about 60 to 70 times in a minute in an adult, and you go about 90 to 100 times softly in an infant. Softly in an infant is that you don't push inside extremely hard. That's why with the infant we have about 2 centimeters inside. Okay, when you do this, you check the carotid cord and the femoral, carotid and the femoral pulsations if they are in. You get it. Then after that, if you need an artificial ventilation, if an artificial ventilation is required, you let an assistant or anybody by your side give the artificial respiration after the cycle. So you push for some number of times, you do artificial ventilation, then you check for your carotid and femoral pulsation. Immediately you do that and the heartbeat is established. The heartbeat and respiration, you start feeling the heartbeat, you start feeling the respiration. Transfer the patient immediately to hospital for further management. You transfer the person immediately to the hospital for further management. Now on our next slide, we have images of the process I was talking about. In the very first process, we said you lie the person flat on a hard surface. Yes. So when you look at this particular image, you see the person is lying by the side of the chest, and that's the same thing here and the same thing in this image. And placing the right hand down, then the left hand on it. You get it? The heel down and the left hand on it at the lower part of the sternum. That's exactly where the hands has been placed. Then you push it. This is how you push it. You are just applying the pressure or the weight in you on it. You are not just pushing like that. You are just pushing your weight on it. Yes. As I mentioned, you push and release. When you release, this is how it becomes. And when you push, this is how your hands become. Yes. And then I also mentioned if you need an artificial ventilation. Artificial ventilation is what our nurse here is doing. This is what we call the artificial ventilation. It has to do with pushing air into the lungs for respiration to be established. That is what we have here. Yes, and most of the times it is being done by an assistant. That is, if the first aid team arrives, the assistant will be working on the artificial ventilation. But then if there is no assistant and you still want to do it, after pushing in an adult for 60 to 70 times, you then come back, establish respiration, and do the artificial ventilation yourself with your mouth. That is, if you see that you doing this will not affect you with any other infection. Yes, will not affect you with any other infection. But then, if you think you still need to do the artificial ventilation, it's advisable to use a clean handkerchief, a very clean handkerchief, a very new one, of course. You put it over the mouth of the person and push extra, meaning because there is a handkerchief there, you have to push extra energy, you have to use more strength to infuse that air into the person's lungs for the person to be able to restore his or her breathing. Yes. So this is what we have, and whenever you are able to do all this, call the hospital first. That's the first thing you do. And by the time you finish with this, the people or the emergency team would have arrived. They will take it up from wherever you've got to and transfer the patient to hospital for further management. If you enjoy this, thank you very much for waiting to this particular end, and you have been here to the end. Don't forget to like, subscribe, comment, share.